Thank you, everyone. This morning has been fantastic so far, and I am learning so much. So, as Margaret said, my name is Kaydan Grouette, and I'm excited to share my practicum experience and culminating report titled Evaluating the Impact of Health Collaboration, a review of official community plans in the interior of British Columbia. So first, I'd like to acknowledge that my learnings and work took place on the unceded ancestral territories of the Ktunaxa, Secwepemc, Syilx, and Sinixt people. And as my placement was with Interior Health, I'd also like to recognize that the work of Interior Health takes place on the unceded ancestral territories of the Dakhil Dene, Ktunaxa, Inclemetmum, Secwepemc, Statliam, Syilx, and Chilkatine nations. So my placement was with the Healthy Community Development Team, or HCD, and this team works with Indigenous communities, municipalities, and other partners to create environments where everyone has the opportunity to live well. They focus on upstream work to improve the conditions that shape health and well-being, and by addressing these early on, the HCD team works to reduce inequities and improve overall community wellness. They use two approaches that really helped rooted and centered my project and my report. So the first is a health and all policies approach, which looks at how decisions made in all policy areas, not just the sector of health, can work towards bettering health. And this is done by bringing sectors together to encourage collaboration, community engagement, and political commitment to support long-term health equity. And then that second approach is a healthy communities approach, which builds on these ideas by focusing on systemic barriers and ensuring that policies are inclusive and reduce inequities, especially for marginalized groups and equity-deserving populations. So my guiding question that drove this whole experience was, how is health promoting and equity-focused language and policies reflected in official community plans across Interior Health's jurisdiction, and what patterns emerged in the presence of this language in relation to the HCD team's involvement? So to start working on through that question, I first conducted a literature review to gain background and really help scope out that project to understand what prior scholars and academics were talking about in that broader sense. I then conducted a mapping activity with all Interior Health municipalities. So I collected data on population, year of OCP adoption, and then that level of support the team provided. From there, we selected municipalities that were both urban and rural and having both high level of involvement in OCP updates and low level of involvement in OCP updates. I then analyze and synthesize the OCPs to identify common themes and ideas. So I've been throwing out OCPs and official community plans a lot. So what are they? They are long-term planning documents that guide the development of municipalities and regional districts. These plans typically are used to establish a community's vision and goals for areas like land use, housing, infrastructure, and it can even include environmental stewardship. And they are required sections, which include policies and bylaws surrounding land use, zoning, climate targets, specifically greenhouse emission targets. And then there are also optional sections, which include social and environmental priorities like community wellness, social connection. And these and OCPs typically follow a very structured process to ensure that community input is involved and that planning decisions are evidence-based. So as I mentioned earlier, I used a literature review to kind of help guide this project. And I really focused on the link between community planning and health, with a focus on how health equity is or isn't integrated into planning policies. And the literature, first of all, established a strong connection between community planning and overall health and well-being. It was found that planning decisions influence the conditions in which people live, work, and even interact with their communities. The review also highlighted the importance of embedding health equity in planning, but did note barriers, including limited resources, vague policy language, short term political cycles, and even conflicting priorities. And it was stated throughout that without clear definitions, goals, and accountability, equity can often lack impact in these planning documents. Through the review, it was also found that meaningful community engagement was essential for integrating health equity considerations, and that policies effectively addressed equity were most typical when created through strong engagement and local communities, especially with those equity deserving groups. And then finally, the literature emphasized the role of local governments in advancing health equity and also emphasized a need for greater support and collaboration with public health professionals in this area. So, what does equity actually look like in community planning? Well, equity in planning means that it's ensuring all community members, particularly those from equity seeking or historically marginalized groups, are intentionally included in these long term plans. It also involves recognizing and addressing systemic barriers that affect access to conditions needed for good health, such as safe housing, reliable transportation, affordable food, and essential services. Inclusive OCPs also take a holistic approach by embedding these social determinants of health directly into their policies and objectives. And they also prioritize meaningful engagement to ensure local planning reflects community knowledge, values, lived experiences, and that they're also addressing communities' needs and priorities. So the findings so far have really helped shape the lens through which I analyze the OCPs in particular, the emphasis on health equity, the role of local government, and the importance of meaningful engagement provided a framework for identifying how these concepts showed up or didn't show up in real world OCPs. The findings of this project were very vast, and so I included two very key components of my project, as well as some other key area policies that I felt were quite pertinent to our social and political climate right now. So the first finding was health equity and language. So this varied across all OCPs analyzed, with some addressing those systemic barriers within their community more explicitly and using more inclusive language. And this was found in communities with higher level of support from the HCD team. Regarding housing, all OCPs prioritized affordable and diverse housing options, but the needs of vulnerable populations were addressed to varying degrees. Communities with more support from the HCD team included policies for transitional and supportive housing, while those with less support could really benefit from expanding on these policies and addressing these issues. For transportation, all OCPs supported safe and connected transportation, but the policies typically reflected the community's unique context. So, for example, communities with larger populations of youth or older adults tended to focus on expanding public transportation and improving bus routes. For local food systems, it was a priority for all OCPs as they included comprehensive plans to support food security and local food production. And then finally, community engagement and participation was a key focus. Communities with high level of HCD support had ongoing involvement with local governments and residents, while those with less support tended to lack that continuous community participation. So the findings align very closely with the literature, but also highlights how local context matters. Rural communities often have more capacity in terms of staff, access to data, and even partnerships. So to embed health equity, it's a little easier, whereas rural communities and areas face geographical isolation, aging populations, and limited resources, which affect both the service delivery and planning. This really highlights the value of collaboration. So communities supported by the HCD team were better able to embed equity into their OCPs. Um, but it should be noted that language isn't enough and that many plans did lack clear mechanisms to track or evaluate how these health equity considered policies are being implemented or actually impact their community. And across the board, ongoing meaningful participation leads to better alignment with community needs. And without it, plans tend to risk missing key issues, and equity even risks being performative or symbolic. So overall, the findings highlight a few key takeaways. Capacity shapes what's possible, collaboration strengthens outcomes, and while implementation and engagement remain a common gap, they represent our greatest opportunity for progress. Thank you for listening. And I also like to thank my practicum supervisor, Katrina Lienbauer, and then the team leads, Mike Adams and Jenny Green. And I'd also like to thank Margaret for all your invaluable input and interest in this project. So thank you.